Welcome to Tehachapi, the City of Tehachapi's podcast, where we share conversations with local leaders, business owners, and community members. Don't miss an episode. Be sure to follow and subscribe to learn something new and discover ways to get involved in our community.
Hello and welcome back to Tehachapi. Maya Acosta joined in the studio today with Key Budge. Key, how's it going?
Doing very well. How are you doing, Maya?
I'm doing good. Excited because we just came from a chamber luncheon where we had a nice healthy lunch talking all about blue zones and how to choose nutritional options that are good for us to keep us living long and healthy. And to keep that theme going, we are joined by Jenny Lavers and Bree Patterson with Adventist Health Tehachapi Valley to tell us all the things concerning healthcare here locally. So thank you both for joining us.
Thank you for having us.
Yeah, thank you so much.
Of course. So we heard a great presentation from you, Jenny, at the Chamber Luncheon, and you have a lot going on with Adventist Health. You service the Central Valley at large, but of course we here in Tehachapi care very deeply about the healthcare that we are able to receive through Tehachapi Valley, our hospital here. Can you talk to us a little bit about just generally what's going on at the hospital? What are things looking like right now?
Yeah, Adventist Health Tehachapi Valley is doing really well, knocking it out of the park, if I do say so myself. And just award after award, recognition after recognition. And that's what I got the opportunity to share this morning, is just some of the things that the team there is accomplishing. I shared at the chamber meeting, it's not my hospital, it's not Bree's hospital, it's our hospital, it's in our community. And so it's just something to be proud of, that the hospital that's serving the community is making a huge difference.
Yeah, absolutely. And Bree, you have been with the hospital for quite some time. You worked for the old facility. Can you talk to us a little bit about how the hospital and services have progressed over the years? I'm sure hugely.
Maya, were you here when it was for the old hospital?
No, I wasn't.
Oh,
Okay, so
yes.
that dirt lot that you walk by every morning was the hospital.
That was
Yeah.
it.
Yeah, and it's
We
amazing.
fit the entire hospital on that tiny dirt lot, which is a little weird the times that I go over there because I feel like it was so much bigger.
I know. Anytime that somebody has mentioned that, or obviously the sign was there still until recently, I could not, have not ever, still don't. I can't imagine that, because you see the beautiful facility that's across the 58 on the north side of town now. It's beautiful. So what's that journey been like?
This community waited a long time for that beautiful new building. So I started with the healthcare district in 2015. I worked a little bit in the acute side, but primarily in the emergency room. We did everything we could with the little bit we had in that old building, but as anyone that's been here for a while knows, is that building was old. 1950s was when that part was established. In the 40s, it came down a little bit with the earthquake, at least part of it, so they had to rebuild. And it pretty much stood almost the same until it got brought down, until we transitioned, and then unfortunately, it had to be torn down.
It was like solid concrete walls.
Yes.
And I remember, I remember having to go there with, taking, whether it was my son, myself, my wife, but using that facility while we lived here, it was a blessing to have. And then the service that you guys were able to provide was fantastic, and we were very appreciative of it. But I remember having to get like a scan, or maybe it was an x-ray, and then having to go outside like on the loading dock,
Yes,
and then come in.
to go to the CT trailer.
Yes.
So you used to go out of the ambulance bay down that gurney ramp, which was very steep and surprisingly slippery in winter. Mm-hmm. We did the best we could, but yeah. And so we would routinely have to take patients out, down that ramp, out in the snow, go up the CT trailer, which is just, the fact that we had a CT at all at that small facility was a godsend. But yeah, we have come a long way. And we are actively enclosing the walkway that goes out to our whole imaging pavilion now, where we have CT and MRI, which, 10 years ago, if you would have said that, I would have kind of laughed at you and like, that's never going to happen.
Now, how long has our new hospital been open? How long?
2018, November of 2018 is when we opened.
So we're 7 years. Mm-hmm. That transition from old facility to new facility, what was that like?
It was a little surreal, because we were kind of active in both places. Many that have been here knew that we had some long-term residents in the old facility. They got grandfathered in. Adventist was kind enough to understand that this was their home and grandfathered them in. We weren't bringing any more in, but we were allowed those to move over. So that morning that we transitioned, the few that had been left, we ambulanced over and went live at the new facility. So closed down the ER. Anyone that was there got ambulanced over, and we had nurses and staff and radiology techs and everyone on both campus for that minute. And then this was done and we were all at the new facility. But there was a lot of prep involved. So we had been on a completely different electronic medical record. So we had been doing all the training ahead of time. Everything was in different places. So it was a big deal because we went from that tiny little building to this huge facility.
To a real hospital.
It felt surreal.
Right.
Truly. It was insane. But then, as you know, they say, if you build it, they will come. We doubled our ED volumes in like less than a year.
Wow.
We went from our average daily volume in the ED at the old facility was around 30 to 32 patients a day. And within a year, we were seeing in the 60s in the ED, which doesn't sound like a lot, but in that size space, it was a lot. And our staffing really hadn't changed much. So there were some adjustments. And then I think then COVID came right around the corner. I don't know what we would have done if we weren't in that new facility. Once COVID hit, we had days that we averaged 9 ICU patients. It's a 4-bed ICU in the new facility. There was no ICU in the old facility. If we didn't even have pumped-in oxygen in the old facility. We had giant, what are called H tanks, and they're literally like you bear hug around them. That's how big they are, but they were just in each room by the beds. So if we had to intubate someone because they couldn't breathe on their own, we had to hook it up to that giant tank. And then our respiratory therapist would have to come in and change out those tanks because you would routinely be caring for a patient and run through that tank. So the new facility obviously has beautiful pumped-in oxygen, beautiful pumped-in air, beautiful pumped-in vacuum. So it's so different. And if COVID had hit, I don't even want to think about what that would have been.
You would have done it. You would with the staff that you had at that hospital.
They're amazing staff,
yeah.
But you also I don't know where we would have been. We would have continued to just try as much, but also unfortunately, I believe we would have lost a lot more patients.
Oh.
Which is a sad thing to think about.
Well, thank goodness that didn't happen.
No, it's godsend.
Yes.
Truly godsend, and somewhat serendipitous that we were in there, and we had been in there for a year really before we started to feel the effects. So we had some growing pains, but we had mostly figured out our processes by that point. But
Did it ever feel too big in the beginning?
Oh, it felt huge in the beginning. We all complained that I have to walk all the way down to the cafeteria. That's so far. It's 200 feet, guys. It's not that far.
Yeah.
But still, when you walk from one side of the hospital to the complete other side of the hospital, and it takes you actual minutes now versus the old facility where it was seconds, it feels weird. Now I walk down in Bakersfield or something, I'm like, this hospital's so huge.
Yeah.
Our hospital's so tiny. But man, comparatively to the old facility, just night and day.
And Jenny, and now with our facility, Adventist Health Tehachapi Valley Hospital, it's award-winning. It's recognized by the community as what Bree has shown, that the staff loves being here, being a part of the community. And that shows, and that's something that you were talking about earlier today.
Yeah. I was talking a lot about patient satisfaction scores and all of those types of quality metrics, but when you're talking about just people and the teams that work inside of the hospital, we measure employee engagement, employee well-being every year in an annual survey, and it gives you an idea, are your employees happy? Do they feel like they get mission, purpose, value out of coming to work every day? Adventist Health Tehachapi Valley consistently, I think we're at a three-peat of being the top scoring facility within all of Adventist Health, so that within 26 hospitals, people who work in corporate headquarters, all of that, Adventist Health Tehachapi Valley, the employees come and they show up every single year as the happiest, most engaged team of people.
Well, you got a beautiful community to work in, a beautiful facility. There's, and then of course, we're all easy to deal with, right?
Of course. We have no problem patients ever. I will say though, 90-something% of our people that work for us live in this community.
Right.
So it is their hospital.
Neighbors helping neighbors.
It is neighbors helping neighbors. And so that is a huge thing when you talk to a lot of our staff members, is they know anybody that walks through that door, that's somebody's sister, that's somebody's uncle, that's somebody's neighbor, that's somebody's grandparent. And so you walk down the halls and you're waving hi to everyone because somebody always knows somebody. So it is. It's important for us, and it's not just like somebody knows somebody, so I'm going to act right. They do it because they care, and they're caring for their community. So it's a really nice place to work.
And you guys are continuing to grow. We talked about the, early days of the old hospital and now to the new facility, but there's more to come for resources and services for residents here and in the area. Can we talk a little bit about the exciting new news and what is going to be developed here in the coming future?
Yeah, I would love to talk about it. We are super excited. We closed escrow on the land that is right in front of the hospital. It's between 2 and 3 acres in that parcel right in front. And the idea is we are going to build an outpatient pavilion that will house all kinds of services. And so we've been in this phase right now where we've been dreaming up all of the things that will go in there. We have a lot of opinions. I don't know if Bree has a lot of opinions.
I gave her my Christmas list. Yeah. I said I want all of these things.
Key, do you have
someone who's been
opinions?
here?
I always have an opinion.
Exactly.
Yeah, don't ask me a question you don't want an answer to.
But we've been in this fun phase where we all have opinions, but we're looking at data, right? What does the community needs assessment show? What does the actual statistics say about where our gaps are? And so we've been dreaming up is an urgent care something that goes in there in the future state? And how do we incorporate our specialists and add primary care and lab draw stations and all kinds of services to be able to ensure we're expanding care and access for the community?
Yeah, I know urgent care is always a huge thing that residents talk about. So the possibility of that coming would be, a huge, something that the community would greatly, greatly appreciate. So that is exciting to hear. But also recently a study came out that found that Tehachapi is rated as one of the best places to retire in the country, or I think it was the country. Regardless, this is, reflective of not only the services that the city is able to provide, the different recreation opportunities and whatever, but healthcare is a huge priority for that demographic. Talk a little bit about that. What that made you feel seeing that rating?
It's kind of a funny thing to celebrate. I think it was top 9 cities in California for retirement, and they are scored off of many different things. And so one of the key things that a community gets scored off of, besides their amazing weather, and I think in the article about Tehachapi, it talks about the seasonality and all of those things. But for someone who wants to retire, they need to know that they're going to have dependable healthcare services. It's an important factor. They need to have access. And so in the article and in the scoring matrix, it was one of the reasons that Tehachapi was chosen as one of the best places to retire is because of the access to specialists, quality care, and consistent care. So yes, it's a funny thing to celebrate, but I think, life is too short to not take every opportunity to celebrate all of the wins, but also make sure that we know that this is an everybody award. I don't know if we can take credit for the weather, but I think we can take credit for the food, for the healthcare services, for all of those other things.
Absolutely.
It just adds to quality of life.
Yeah.
It's one of those things that when you pick a place for, like, my wife and I grew up in LA, and down in the city of LA, and we started, as we knew, as being young married, it was like want a family. We don't want to raise a family in LA. That was the key. And we started to kind of migrate and to try and find. And once we found Tehachapi some 23 years ago, was like, okay, this is the slice of Americana that I've been looking for, the mythical island, if you will. And it's just been a great place to raise a family. But then now that we've got, fantastic health care, it just now as I look towards retirement, it does factor. Because I do find myself going to the doctor more than I did when I was in my 20s, 30s, and 40s. And it plays a major role. And I've already had a surgery, what they called an elective surgery, having a hip replacement, getting old. But it was done here at Adventist. And I think it was the first hip replacement that was done there through Dr. Bosque, the orthopedic surgeon. Fantastic job. I'm still up bouncing around here. And that was in 2020? It was during COVID, so it was either 2020 when the elective or 2021, not sure. But so I've been bouncing around on this thing for at least 4 years. But the care that I got at the hospital was incredible. And it was just one of those things I look back, because I ended up spending 3 days. They had a little complication. I had to stick around. And then but the care from staff was incredible. So I've got a close connection. And so whenever I get an opportunity to go back, whether it's having x-rays, other scans, blood work, things like that, very comfortable with the care that I receive inside those doors.
I'm so thankful for your experience, and it reminds me to remind everyone about one of the services we have inside of the hospital that we don't talk about as much. So inside of the hospital, we have what we call our swing beds. Essentially, they are rehab beds where patients can come after a surgery if they have a complication, if they need some rehab services before they go home. And so I think sometimes we think that it has to be in a skilled nursing facility or in a dedicated rehab facility. We have that ability right here in our hospital, right in our own backyard. And so wanting to make sure people know that that's an option for anyone who's interested, and who wouldn't want to recover and look out the windows up here versus being in a facility down in Bakersfield.
Well, and that was an option. They said, we can go ahead and send you down to Bakersfield. I said, no. I said, I'm going to go home. And I said, you can't go home. And I'm not going to Bakersfield. And I was dead set on that. And they said, okay, we'll make it comfortable.
And a lot of our community members feel that way.
Yeah.
And so it is wonderful that we have such a better facility now than we used to, and that we're still able to continue to do things like this. That swing bed program is huge, and we keep a good volume of patients in it now. It's grown and it's getting more and more robust. We have an occupational therapist full-time on staff. We have physical therapy full-time on staff. There's nurses who are providing care all the time for that specific program, and it allows our community members that need a little bit more love to stay closer to home. And we know, and research and evidence shows that if you are in your community receiving that care, you get better faster.
Now, let me just ask this. I'm sorry, I interrupt. No one knows, but I know I just interrupted Jenny. I wanted to ask kind of about the doctors and the transition that takes place, because I know with the new facility was a little bit harder to get doctors because no one was living here. Right. And when I ask you about Dr. Bosque, and he's still part of staff, that was 4 or 5 years ago, and he's still a part of the staff here. I mean, that speaks volumes about holding on to an orthopedic surgeon in a small community like this. And I know he's probably based in Bakersfield as well, and he has office days up here. But the fact that he'll do surgeries here, he'll see people here, and it's not like every year you're finding a new orthopedic surgeon to come in. Things are changing.
Yeah, I would say being one of the benefits of being part of a network of hospitals and services is that you get to share resources. One of the benefits of being part of Adventist Health Tehachapi Valley is one of those specialists come up here, they never want to leave. So you hire them and you think, oh, you're going to be in Bakersfield, and then they're actually like, oh, I want to come up there as much as possible. We have 3 different orthopedic surgeons who are rotating through our clinics up here in Tehachapi Valley because they all fight over who gets to come, and they love the experience, they love the patients, they love operating in the hospital up here. Our surgery leader on the campus is just so amazing at making sure that she's making it great for patients and the providers. But not just for orthopedic surgeons, we now have a breast surgeon who's coming up here. I talked about this a little bit at the chamber lunch. So when I say breast surgery, people think breast cancer, which absolutely it is. But there's so many more things. So benign breast disease, people who have bumps and lumps. Her name's Dr. Nicole Gordon. She also does high-risk genetic testing. So for people who have possible mutations or need to be tested for family history, she manages all of that. In conjunction, we have a medical oncologist who's doing rotations up here. So Dr. Agna Hotri. Anytime we have somebody with a cancer diagnosis, for chemotherapy, they have to go down to Bakersfield. But for supportive medications, we have the ability to do that right here. So anytime we can save someone a trip down the hill, or if it's somebody who's just maybe struggling with some blood disorder, anemia, iron deficiency, all of those things we can treat here. So every time we add a specialist, it's just more services, enhanced services where we can keep people close to home.
And that's huge. It's growing the doctor population that is here, or all the healthcare professionals that live here in the community. But you guys also are growing a residency program. Can we talk about that and how that will continue to do exactly what you were just speaking on?
Yeah. So it's the brainchild of the medical director of our ambulatory program. His name is Dr. Raul Ayala. He grew up in Texas. He's amazing. He wears cowboy boots to work every single day. He was practicing in the north part of the Central Valley, and he saw this just growing need where we had more patients than we had doctors or providers to be able to service them. And so he had this vision and dream of how do we grow our own. So he started up in the Hanford area, grew this amazing residency program, and he has taken this vision and is just expanding it to community after community. So all within the Central Valley. So I'm not talking about going down to LA. They got their own programs. They're fine, right? The idea is how do we grow them here close to home? So we expanded to Bakersfield. We have 4 new internal medicine residents that started just this month. We've already submitted the application for Tehachapi, so we will have a residency program. One of the things about building that outpatient pavilion is it will be able to house those residents for services where they'll do both hospital services but also outpatient clinic services. And this is our opportunity to kind of wine and dine them. Am I allowed to say that? Wine and dine them.
Oh, yeah.
Show them the beauty of Tehachapi.
Yes,
Yeah.
and show them why they should not just come here, but stay here, live here, and be here forever.
And you called them baby doctors, right?
I don't know if I'm allowed to say that either, but when they're just coming into the program and they're just getting their white coats and brand new into it is sometimes they're definitely younger than me, and so I do call them baby doctors, but that's where it's
so not pediatrician. We're talking.
No,
these are the
yes.
rookies. These are the newbies.
they're
New doctors.
Okay, new doctors.
You know, if
Okay.
you're in an engineering field, they're
not baby doctors.
they're associate engineers, or new grad nurses, or
Gotcha.
every field has a different name for them.
Right.
In the medical field, they're residents.
Okay.
They're doing their residency. They've finished medical school. They've graduated medical school, but they're doing a residency. They're truly learning that specialty.
Okay.
Right now
AKA
it's
baby doctor.
AKA baby doctor.
but they're full-grown adults. The funnest part is what we're seeing is we have a lot of physicians in our communities who have children who are now becoming doctors and carrying on that legacy, and so they want to come back home and carry that on. So Dr. Medella, primary care physician in the community, he was down in Bakersfield, retired by now. His son has now gone through the program, graduated, and now works for Adventist Health in the medical group in one of our rural health clinics. And so really cool to see just someone who already spent their entire lives serving our communities continue that on with their son.
Love that.
Yeah.
Yeah, it becomes another generational industry here within our community. We've got with Tehachapi Cement, generational. The other mining with going on in Boron with Rio Tinto, generational. And now, so proud to say, our medical industry, the quality of life is now becoming generational.
Yes,
People wanting to stay.
I tell people all the time, and if my husband listens to this, he's going to roll his eyes, but that he tricked me. So I went to Cal Poly, I met a cowboy, he took off his hat, and that was it. That was all she wrote. But I came home, my husband's a cattle rancher, I came home and I had no idea what it was like to live or work or be part of an agricultural lifestyle. And want to talk about legacy and generation and just culture. The ag industry, or whatever industry it is it's so deep rooted in its fundamentals, and so any chance you have to continue that on is really just shining a light and paying homage to the people who came before us.
Yeah, it speaks volumes of the quality of people that are here.
It also really, the residency program is huge because, as you touched on a little bit earlier, when we were at the old facility, we really struggled to get doctors who are here and who want to be here continuously, that aren't just coming in to provide their snippet of time and then go back to LA type thing. Well, a residency program is how we get them at the start of their career and they want to stay here. And then they turn into the Dr. Horowitzes who stay here, open medical practices, maybe someday retire. He keeps threatening, but then he stops. So, but our providers that work up here, they're getting older and they are going to retire and they're not going to be able to practice. So we have to bring in the next generation of doctors and we have to help them fall in love with Tehachapi so that they want to stay here. I mean, we're kind of winning on the hospital front because our ED medical director and our hospitalist medical director both live here somewhat locally, a little bit out and or over, but local to the greater Tehachapi area. So, I mean, we're slow and steady wins the race. We're winning people over one person at a time.
Yep. We just had General Wickard from Edwards Air Force Base on the podcast. And I guess the podcast this will probably air before the General Wickard interview. But one of the things that he kind of touched on was really trying to find, especially with the civilian support staff, is homegrown and finding people here in the community and keeping them, and getting them involved in the STEM programs because there's opportunity here. This community is sophisticated, it's educated, and yes, we're rural. And we live live here because we don't want to live in the city. And I'm a prime example of that, growing up in the city of LA and finally finding that place where I go, this is where I want to raise my family. And proud to say that my son has decided, he and his wife are raising their family with our grandson here in this community. So it becomes that we found this little slice of, like I said, Americana that's perfect. But these new residents, these new doctors are going to get exposed, and hopefully they'll take that in.
I mean, I call them baby doctors in jest, but also because it's our chance to imprint on them, right? So it's like they're fresh into the world. And so how do you make a lasting impact that shows them who they want to be and helps create where they want to be?
Yeah. It's funny. I've met a couple of doctors on the pickleball courts here at the police department, and one said that he was coming up for whatever his day, that he and his wife chose Bakersfield to buy because there was lots of pickleball courts and we didn't have pickleball courts at the time, and he was ticked off that the timing was off, that we didn't build these courts until a year ago here in town, because that was one of his deciding factors. So you can start to tell the residents as they come in that
We have pickleball.
We have pickleball.
We have pickleball.
Add to the checklist.
Yes. Well, I mean, we're growing new pickleball courts, new additions to the hospital property, but also things like Saracoso building a new campus here in town. Yeah. That's huge. The developments and investments in creating just such a well-rounded community for us here. Rural, but we're getting the services that have been hard to attain at times. So it's great to see that. Speaking on Saracoso, is there any sort of connection between some of our local colleges and what Adventist Health does here in the Central Valley?
So funny that you say that, and I think it's the beauty of being in a community like this. Is I was talking to two of the people at the chamber luncheon about the new program, and so she was asking they're going to create an LVN Psych Tech dual program. They need partners to be able to get people the right clinical hours, and so we were saying is that in some organizations it would take 52 emails and 7 meetings to get there. At lunch today, we said, okay, let's do it, and it really can be that simple and that easy when you have people who just want to do the right thing for their community. So we were just talking about launching that program as they expand that campus.
That's
and we
awesome.
already partner with several of the colleges locally that provide different medical experiences, and even, not just from the nursing world, but we do some of the MA stuff and the paramedic programs that are local. So we routinely have paramedic students in our ER. So, and that's been stuff that we've been doing since we moved over to the new facility. And we've had the more patient population to be able to actually train up our baby paramedics and our baby nurses and our baby other people.
And maybe the space, too. You've had the space now.
Yeah.
And my son is a paramedic, and he actually did spend time in the ER. Yeah, he did.
That's awesome.
Between here and also at Ridgecrest. And so he got his time in. But he was happy when he was able to do it locally, But
it's a big deal to a lot of them when they're trying to find those hours and they're having to travel so far, especially if they live up here and they're going down to Bakersfield or up to Ridgecrest. I hear that from a lot of them.
Yeah.
It's so nice to not have to drive an hour after a 12-hour shift.
Yeah, exactly. Well, I know, Jenny, we're pushing time limits for you. So I want to, before we kind of transition off, I want to ask you, is there anything else that we haven't talked about that you wanted to share, mention, that's important for the mission of Adventist Health overall?
I think any opportunity, and part of the reason for coming on the podcast, is how do we ensure that people know what services are available, and wanting to make sure that anyone who, whether they're self-employed, they own a business, they're just individuals, is if you're looking for a service or need something and it's not coming up on the internet, it doesn't mean that it can't happen or that it's not part of our future plans. And we were talking about this earlier for breast screening. Someone asked me, when are we going to get 3D mammography? We have 3D mammography. How do we make sure people know about it? Do we need to partner with businesses differently to help do breast screenings or other type of preventative programs? Adventist Health mission is living God's love by inspiring health, wholeness, and hope. What I would say is our mission is to serve the community and to do it well and to do it in a meaningful way. And so if we can do something differently, better, if we need to grow in a different way, that's why we're here and having these conversations.
Definitely.
And something that one of Jessica, who's part of our staff that works with Maya and I, she had heard you speak before. And one of the things that came across in the session that you shared was talking about compassion. and having compassion and bringing that into the medical field is because it's, I'm sure with the volume of people that you see, and being a retired cop, I know it's kind of like, okay, now I got to move on to the next thing. But you talked about the importance of having empathy and compassion. That really resonated with her.
Yeah, I had the opportunity last summer to speak at the Women's Business Conference, and I told a very deeply personal, vulnerable story about a healthcare event in my life and how it happened and what it was like from my perspective. Very similar to what you were talking about during COVID is to have a kind of a traumatic event happen during that time is not only is it terrible to have something like that happen, but the way you experience it during a pandemic is just different. And so what I was challenging women in business, what I was challenging Adventist Health is we have to, like, okay, someone tells you to do something, but if you know in your gut it's not the right thing to do, or if you see the person in the bed at the end of the day and you know that what you're doing isn't serving them, it's okay to stop and say, hey, I'm not sure in this moment this is the right thing. It's okay to say pause, to stop the line, to hold on for a second and know in your heart that you're doing the right thing.
We really have a focus on compassionate quality care, and all of the other things will fall into place. So if we are always putting the patient at the center and we're always trying our darndest to do what's right by the patient, everything else just kind of falls into place. The financials fall into place, all the pieces will fall in line because that's ultimately what it's about, doing what's right by the patient, which doesn't always mean doing exactly what they want, but you're doing what's right and you're doing it with compassion.
Well, I can say from the patient side that I felt that, going through, my surgery and all the dealing with different staff members in Boss K's office. And it was just, I felt heard and felt good and knew that whatever was being told to me was, like you said, this is really what needs to take place, but I understand what you're feeling and what you're saying. And it was just a really good experience for me. So I can second that was my experience.
Great stuff. I mean, how important is it for somebody to go into a hospital, which can be a very scary, intimidating, vulnerable spot, whether, it's for just more routine care or for an emergency, and to be met with compassion and care. It's so, so important in today's landscape. So we appreciate all that you guys do.
Thank you so much for having us today.
Yeah, thank you both
A
for
lovely
coming
opportunity
in.
to come and chat.
Of course. We learned a lot, and I hope all the listeners did as well. If people want to learn more about Adventist Health and the hospital here, what's the best way for them to do so?
I would say online, Adventist Health Tehachapi Valley's website, or to just call the phone number, which I don't have off the top.
We'll put that in the story
I was
notes.
going to say, 771-3000 is our general number.
It took Bree a second
I had
for
to
the
think about
record.
it
She
too.
had to think about it.
I don't call the main hospital line very often.
You dial extensions.
I dial extensions, or I call our house supervisor directly, and that's like on a cell phone. So
Right.
It's programmed in my phone.
I was about to spit off that number, and I was like, oh my goodness, my house supervisor would probably lose her mind if she started just getting all of the questions. She'd answer them willingly, but she'd probably be like, what did you do?
But on our website, there's a form you can fill out requesting information, giving feedback, or it's just general inquiries, and all of that gets routed to us. And so it's an easy way for us to get back to people.
Awesome. Thank you guys so much for coming in today.
Yeah, thank you for having
guys.
us.
Key, thanks for joining us.
Oh, it's always a pleasure.
Yeah. And to anybody listening, if you have questions or comments, you can email us media@tehachapiCityHall.com. But otherwise, thanks so much for tuning in, and we hope to catch you back here next time on Tehachapod.
You've been listening to Tehachapod. If you have a question, a thought, or a suggestion, email media@TehachapiCityHall.com. We'll catch you again soon, right here on Tehachapod.